Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife, sex and intimacy, real and true, evidence-based, made just for you.
Hello, and welcome to Dr. Jeff Talks About Sex and Intimacy, where we explore the science, the stories, and the human side of connection. Today, you're joining us for episode 65, Kegel pelvic floor muscle exercises for continence and intimacy. Whether you're watching us live or listening to the recording later, every moment of your amazing life matters, and I count it a true blessing and a gift that you are here joining us to improve your life. I sincerely thank you. I just really want to thank you for being here because honestly, you're the whole reason that this podcast exists. You're why we're here. We're connected across so many platforms. We're on Facebook, we're on YouTube, we're on LinkedIn. If you're joining us on X, and you want to submit a question, hop over to YouTube, LinkedIn, Facebook, one of the others, StreamYard, and you can interact directly with us. If you are a Facebook person, please put us in your favorites, because the more people who are followers on Facebook, if you're a follower, the more we can do on Facebook. So please follow us on Facebook. Visit the website. We have had so many amazing guests on the show, over 50 different people, experts in the field of sex and intimacy. You can watch all the previous episodes. You can pull up the calendar and see what's coming up next. So go to the website to find out more. You can take us with you. We are streaming live. We are streaming wherever you are, whether you listen to us live or the recording. We are on Spotify, Amazon Music, iHeartRadio. Take us when you work out. Take us on your road trips. Dr. Jeff Talks About Sex and Intimacy is on the go with you. As always, I would just like to take a moment to remind you that everyone is welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, I'm just so grateful that you're here, and this space is for you. The mission of the podcast, it's really simple. It's to empower and enlighten you with the scientific-based information you need to improve your sexual health, to deepen your relationships, so you can live your one miraculous, wholehearted life with more love. That's our goal. Today's episode, I'm really excited about it. It focuses on something that's often overlooked, yet incredibly powerful when it comes to both physical function and intimate well-being: pelvic floor muscle health. Some people refer to them as Kegels because Dr. Kegel developed them way back in the 1950s. Some people pelvic floor exercises, but a lot of questions occur around this, whether it's improving your bladder control, enhancing sexual function, or rebuilding confidence after medical treatments or life changes. The pelvic floor plays a central role in so many of these things. Yet many people are either unsure, how do I engage these muscles correctly? Or they don't realize how deeply they impact intimacy, pleasure, and quality of life. So joining me today is one of the leading experts, my friend and colleague, Dr. Diane Newman. I'm so excited to have her on because she is the person, the go-to person about Kegels and pelvic floor exercises. And we did a previous episode last year on this, and so many people are interested that I asked Dr. Newman to come back, and she's been on the show before as well, and specifically talk about this topic, which you have been asking about. She brings decades of clinical insight and research to help us better understand how pelvic floor muscle exercises, commonly known as Kegels, named after Dr. Kegel, can be used effectively and safely. Now, if you weren't here for previous episodes with Dr. Newman, she is a doctor of nursing practice, a fellow of American Academy of Nursing, a board-certified pelvic floor muscle dysfunction specialist. She's internationally recognized, trust me, for her expertise. I have been around the world, and Diane is everywhere when it comes to urology, bladder health, and the pelvic floor. So, particularly in areas of urinary incontinence and pelvic floor health, overactive bladder, post-prostatectomy, cancer rehabilitation. And she serves as an adjunct professor of urology and surgery and has been a leader. I can tell you she is a true leader in educating both clinicians and patients on evidence-based approaches to pelvic floor muscle training. Wow, Diane is a prolific author, a prolific educator, and she has done amazing research to advance the practice of urology. And so Dr. Newman has published extensively in peer-reviewed journals, and she's a sought-after speaker worldwide, spoken all over the world. Her work has been instrumental in helping patients regain continence, restore function, and improve quality of life, including the often overlooked connection between pelvic health and sexual intimacy. I could not be happier to welcome my good friend and colleague and expert in this field. I can't think of anybody better than you, Dr. Diane Newman. Welcome.
Thanks so much, Jeff. That was such a wonderful introduction. And, you know, Jeff and I have been colleagues now for many, many years in the field of urology, and he's right. A lot of these urologic problems people don't want to talk about, and this is one of them, right, Jeff? As far as, am I gonna lose bladder control? Am I gonna leak when I'm having sex, when I'm with a new partner, or with my established partner? It's so embarrassing, and it's an area that's really hidden. People do not even talk to their closest individual who they may be sexually active with. And that's really a shame. So I appreciate you educating our audience, you know, about this topic. That's okay.
Mm-hmm. Well, I'm really excited for this subject, definitely, because and that's what we do here on Dr. Jeff Talks About Sex and Intimacy. And I know you have some amazing educational podcasts as well. And our goal is just to pull these things out of the closet and help you understand them, listeners. So I can't wait. I'm ready. I'm going to hand this over to you. It's all you, Diane.
Okay, I just want to make sure you can see my slides here, right? I'm sorry, Jeff, are you there? I think I've lost you.
You're good to go, Diane. You're good to go.
Okay, I would like to discuss with you about, you know, the pelvic floor muscle, as well as the exercises you can do for continence and intimacy. And as Jeff said, I am an adult nurse practitioner, and I'm here in Philadelphia. So let's talk a little bit about the pelvic floor. You know, urinary incontinence during sex is called coital incontinence. And this is leakage with penetration, which is referred to as stress urinary incontinence. And that can be due to a weak pelvic floor, poor urethral support, increased pressure from above. So during penetration during sex, it can put pressure on the bladder, causing that individual to leak urine. It often coexists with leakage with coughing, laughing, or exercising. We can also have something called urgency incontinence, which is when the bladder contracts when it shouldn't, and that can cause also incontinence during sex. Key drivers in women is pelvic floor muscle weakness, maybe from aging or childbirth, the fact that we lose estrogen as we go through menopause, and that area of the pelvic floor, the urethra and the bladder, needs estrogen. So a lot of times I'll recommend estrogen, transvaginal estrogen, as in creams or tablets, and that can actually make that area healthy and may also prevent any type of like urgency incontinence. We also have a hypermobility of the urethra, which means that it's not really in its place where it really supports and is helpful to prevent any leakage during sex. Now with men, we see post-prostatectomy leakage during sex, and that is when men who may have undergone prostate surgery for prostate cancer, that surgery is in the area of the urinary sphincter, and what can happen after sex, is with orgasm or with an erection, a man can leak urine during sexual activity. And that could be due secondary to the surgery because there may be damage to the urinary sphincter, or it could be during orgasm or arousal. I'll have men tell me that when I orgasm, I leak a few drops of urine. Another term that we use is climateria, which means urine leakage during climax. They may have daytime incontinence, men, after prostate surgery, and that could again be because of the area of trauma in the area of the sphincter and the base of the bladder. But some men, as they age, may also develop overactive bladder symptoms. Both men and women can develop those. And that could be that they develop urgency during sex. This can be seen with men who have an enlarged prostate or BPH. Now, let's talk about the pelvic floor muscle. The pelvic floor muscle, both men and women have this muscle. Think of it like a hammock. It attaches to the front. I think I have a picture here which might be better. Around the urethra and the vagina and the rectum, and it comes back around and attaches to the pelvic bone. As you can see here, it sits in the pelvis, so that's why we call it the pelvic floor muscle, but it is a group of muscles in both men and women, and it supports, in women, the bladder, the uterus, and the rectum. In men, this muscle is not as supportive, but it surrounds the urinary sphincter at the level of the prostate. And again, it attaches to the pelvic bone, the pubic bone in the front, slings around the rectum, and comes back around to the pelvic bone. So this muscle is very important for men and women. And as I said previously, that it's supportive for women. It controls urine and feces and stool, okay? So it controls those valves that keeps the urine in so that we don't leak urine, or keeps stool, feces in so we don't lose your stool. But it's also important for sexual function because it supports erectile tissues, enhances sensation. So it's really it keeps our core stability. So this muscle is very, very important in both men and women. Now, we have two types of fibers. We have what we call type 1 or type 2. Type 1 is slow twitch muscle fibers. What that means is that the slow twitch muscle fibers, over time, hypertrophy and are supportive, okay? So that really is, we call it static tone. It supports those muscles so that they're tight so that we don't lose urine when we walk, laugh, cough, or sneeze. The fast twitch muscle fibers, which is only about 20% of these muscles, these fibers are only about 20%, they actually increase strength in the muscle. So think of like a basketball player. He keeps jumping to hit those hoops. Those are the fast twitch muscle fibers that build strength. So the slower bulky fibers, the fast twitch or the type 2 are strength muscle. And if you work these muscles, you can build both strength and bulk in them. And actually doing a pelvic floor muscle contraction, like what Jeff said for Dr. Kegel described these in women, can really be a healthy thing to do to maintain bladder control, but also to really enhance sexual function. The goal of training these muscles is to identify the correct muscle and to do exercises. We have you do both short muscle contractions, which build those type 2 muscle fibers, and long contraction, which build type 1. So, and then you want to use them to prevent urine loss. Like I teach patients all the time, men, prior to a cough, tighten the pelvic floor so you don't lose any urine. Same with women, prior to maybe a laugh, prior to exercising, so you can use these muscles to really control your urine. If you do the muscle contraction, you should feel an inward and upward sensation in the area of your pelvis. So women may feel a tightening, their vaginal area tighten up, or you will feel your anus tighten. Men will feel their anus, since of course the men don't have vaginas, but it should be like a lifting and a pulling in. And you really want to support that area so that with increased pressure from above, again, there's not any downward pressure causing urine leakage. How do I teach patients these exercises? I teach men and women all the time. And I usually teach them by tightening around their rectum because we tend to have a better sensation around our rectum to hold back gas, say. You could do them after avoiding to maybe tighten around to prevent urine from coming out when you urinate. But really, you should really do both quick and long. A quick contraction is a 2-second contraction, relax for 2. A long contraction is for 5 to 10 seconds, followed by muscle relaxation. And I have individuals do these exercises, maybe 30 exercises twice a day when they're at home. Men who do these exercises may see their penis move because remember, you're contracting around the sphincter, which is around the urethra, which is the tube where the urine comes out of your body. They may actually see their penis move. Now, as far as Kegels, Dr. Kegel really described a structured exercise program like I've just explained to you. I don't like patients, men or women, to do these exercises while they're urinating because you don't want to prevent that flow of urine. So don't do it during urination. Do these exercises away from urinating or peeing. The other thing that I teach that really helps is called the NAC, or a stress strategy, or a stress squeeze. And what that means is that it's the NAC, so the habit of doing something before an event. So if I find that I will leak urine with a cough, you want to contract the pelvic floor muscle before that cough. So you want to do that, tighten that pelvic floor, do that muscle contraction, and then cough. Or before lifting something. You know, I teach my male patients this who may have incontinence after prostate surgery. And I tell them, they'll tell me they leak urine during golf. And I'll tell them, well, hey, why don't you try to contract the muscle prior to a golf swing? And they always tell me, hey, you're worsening my golf game, Diane. But that's the concept. If you keep doing this, it becomes a reflex. The pelvic floor muscle knows to contract before that downward pressure that can occur with a cough or sneeze. So whether should I tell people they can do it lying or reclining, you want to really tighten and lift your pelvic floor muscle like you're holding back gas. You want to do quick contractions, 2 seconds, 5 to 10 second contractions, followed by relaxation. And like I said, you can do them 3 times a day or 2 times a day, maybe about 20 exercises with each session. Now, I want to share a little bit, Jeff, with you and the group here is listening about the correlation between pelvic floor muscles and sexual function. Let's just go to women. Women with stress incontinence, so they leak urine with laughing, coughing, sneezing, often experience reduced sexual function because that pelvic floor muscle is weak and they're embarrassed. They fear they're going to leak urine during intercourse. And actually, it diminishes your sexual drive, arousal, and satisfaction. And I have to tell you, women hide it all the time. They hide it from their really intimate partner. And that's really a concern. And they really avoid sex. So if you strengthen the pelvic floor muscle, that can help with tightening and strengthening your muscle and actually maybe linked to improved orgasm because they've shown that a weak pelvic floor muscle can cause women difficulty achieving orgasm. Stronger muscles, particularly because, again, that whole pelvic area is related to our clitoris, it may actually enhance or arousal or orgasm. There was a systematic review of databases around pelvic floor muscle training and sexual function. And this was published in 24 in the Journal of Obstetrics and Gynecology. And they showed that they looked at the whole literature. There were 21 randomized controlled trials where pelvic floor muscle training improved the female sexual function index. So this is a survey. And basically it showed that with a survey, women who did pelvic floor muscle exercises improved their sexual function. Again, but this evidence is not as strong as we'd like, but it's there. Now, and this kind of just shows you some of the publications in women pre and postpartum, postmenopausal, and those with health conditions like MS. And it really showed that there's research out there showing in all these groups, strengthening your pelvic floor muscle, getting control over that pelvic floor muscle can enhance sexual function. Now let's go to men. There are some randomized controlled trials showing that pelvic floor muscle exercises can help erectile dysfunction. So men who have ED, erectile dysfunction. And systematic reviews have shown it's beneficial for erections. There's been some nice studies showing that doing pelvic floor muscle exercises Strengthening that pelvic floor actually can prolong your erection and may also help with premature ejaculation and can help overall sexual performance. So it's really a win-win for men. And, we may think of pelvic floor muscle exercise as women because we've had babies and, if we had vaginal delivery, we may have some incontinence. But we now know in men, it can also help sexual function. And you need about 8 to 10 weeks of training, which is what we've seen in the literature for men. But it improves that blood trapping in the penis. So an erection, I'm sure you've heard Jeff explain this in previous, podcasts here, that, an erection traps that blood in the penis to make it erect. Well, doing a pelvic floor muscle, strengthening that pelvic floor muscle can actually improve that blood trapping in the penis to enhance an erection. It may enhance ejaculatory control and again support erection rigidity. A lot of times people say to me, well, how can I exercise this? What I did is I actually created some MP3 files to walk you through an exercise session. And if you go to Grand Rounds in Urology, or if you put your phone up to this QR code, you can go there and download one of the MP3 files. They're about 5 to 7 minutes in length, and you can download them and play them on your iPhone or your Android and actually do an exercise session. I have more information there if you want additional resources. So please go to Grand Rounds in Urology, or if you go to Google, put in Diane Newman, you'll find some of my educational resources. So thank you. So Jeff, you want to have a little bit of discussion about this and talk more about, what people can do and what you've seen in your practice?
Awesome. Gosh, so much good information and practical good information. I think too, Diane, I always try to tell people, they're kind of like, well, where do I start? And I say, begin with, maybe 5 to 10 quick, 5 to 10 slow contractions. We'll make sure you're doing them right. And then do those 2 to 3 times a day, and then build up to, that level, like you said, where you're doing about, 30 to 60 a day or so of the quick and slow. They're both important because we work both fibers, so important. But I think the consistency is the main thing with these patients. And you and I have both seen these exercises can transform lives. They've transformed many of my patients' lives, and I know they have yours patients too.
No, I know. And, but what really gets to me though, Jeff, is how many people hide this? And they have strong relationships, whether it's with a husband or a wife or just a partner that they, and I say to them, well, I always ask, do you have any leakage or any problems with your bladder during sex? And then they'll tell me, yeah, I avoid it. Another group that I see really is women who are widowed and who are now trying to get back into, finding somebody, okay, and maybe having some, and they're so worried about it that they come to me and say, I have a new boyfriend or I have a new girlfriend and I'm really worried about this. Can you help me? But they've lived with it for years. And that's what gets to me, is that it's some kind of event that triggers them to step forward because they're so embarrassed about it. And also they don't know who to go to talk to, right, Jeff? That's the other issue. Who do you go to? Who do you see that can help you?
Definitely. That's so true. And, it's such an honor and a privilege to work with patients on these because they are life transforming. And like you said, the patients are embarrassed. They don't want anybody to know. And what's so great is they can help with so many different things: urgency, frequency, the stress incontinence, so many different urinary issues and sexual issues. So I think it can really be life-changing to learn to do these appropriately and to be comfortable with them. And it's not that difficult. I like the way you talked a little bit about, with my men, I always say, well, with all my patients, first off, I say, squeeze before you sneeze, right? And so squeeze before you cough, squeeze before you sneeze, squeeze before you lift, because it can make a difference and it can stop the leak from occurring. I think that's a central message that I always try to get across to my patients is squeeze before you sneeze, cough, or lift. And the men are like, well, how do I know I'm doing it right or wrong? Because I see a lot of post-prostatectomy men, and I'll say, stand in front of the mirror. You do not have to stick your finger in your rectum. You will see your penis or your scrotum bob up when you do this appropriately. Your abdomen should not move, but your penis or scrotum will bob when you do it appropriately. And they're like, then I show them and they're like, oh my gosh. And like, this is all you have to see to know you're doing this correctly. And then the women too have often learned, and I say, you can place a finger in the vagina or the rectum and tell whether you're doing it correctly, but it's not a difficult thing to learn to do correctly, and it really can change lives.
Yeah, I'm glad you brought those points up, because you're right. A lot of time, one of the biggest barriers or challenges is finding the correct muscle. So, I always say, you're right, tighten your rectum. Men, like you say, should see their penis move as they contract the pelvic floor. But us women don't have anything sticking out. So, so putting your 2 fingers or 1 finger in the vagina, or I'll tell them, if you're sexually active and you're doing vaginal penetration, your partner should be able to feel a contraction around the penis, okay? Because that's a pelvic floor muscle. One of the things I always tell them is, say you're like in an elevator with a group of, the elevator's packed, and you feel like you're going to pass gas. What a lot of us do is we tighten our anus, right? We tighten our rectum. So that's the end of the rectum. That is the pelvic floor muscle cutting off the rectum. So like I always say, like you're holding back gas. So that's another way to do it. But I think that is one of the most difficult things, is isolating your muscle and learning it. So it does take some time, but it works. And I tell patients, if you're sitting on a chair, you really should feel your pelvis lifting up. Okay, so you should feel, if you're tightening the correct muscle, you should feel around your vagina pulling up, or your rectum pulling in, whether you're a male or female, and that's really the pelvic floor muscle.
Yeah, and I think once you kind of get it, and like you said, I think sometimes people, when they learn or have been taught, they'll say, well, cut off your stream of urine. But like you, I hate for people to do this when you're urinating. And the reason that why Dr. Newman and I both completely agree, that while you're urinating, your bladder is contracting while your pelvic floor is relaxing. So when you squeeze your pelvic floor during urination, you're working against your own physiology. So even if you do it to kind of see, you can cut off your stream in that. Do not do your exercises during urination, and do not regularly do that, because you're going against your own physiology. The reason that clinicians sometimes will tell you to try and cut off the stream is so that's the group of muscles we're talking about, the pelvic floor musculature, that does that. But as you're urinating, you need to let your body do its job. Your bladder will contract down, forcing the urine out, and your pelvic floor below will relax beautifully to let the urine flow. So let that happen. That's really important too. That's why when you tense during urination, or you're trying to squat above the pot, you're not able to urinate as freely, because your pelvic floor can't relax like it does during urination. So
and you bring up another really important point, is that you're exactly right. You don't want to do it during voiding. It's not a good thing to do, because you want that bladder to empty. Now you brought up something else that men will say to me. They're worried that if they're leaking urine, the urine's going to harm their partner. Okay. And one thing I recommend is, if you're really first of all, I would not worry about that. But if you are, you could put a condom on, okay? And then that way, no one's going to be impacted by any urine leakage. So that's a good thing to try if you want. The other thing that's really important is make sure you urinate before sex. Make sure your bladder is empty, as empty as it can be, because that way then you're apt not to have as much leakage or have to go to the bathroom. The other concern that some people have too is they get urgency. And they'll say, well, in the middle of sex day, and I feel like I've got to go pee. Again, maybe you don't want to do some alcohol before sex. I'm saying to you, maybe, anything that might trigger you having to go to the bathroom. So think about that. So you may have to plan a little better. But I really stress, talk to your partner about it. Most people, depending on your relationship, don't really care. Okay. They're like, oh, well, so what? We're not talking. Sometimes it just drops, Jeff, right? Sometimes it's just a little bit. So, and especially if that bladder is empty, it's not going to be a large amount of urine that comes out. And, talking about it, I think, is so very important.
I think you are so right. And I know, listeners, that it can be embarrassing. I do understand that. But remember, urine in general, it's not going to, if it goes into a mouth, if it goes into a vagina, it's not going to cause problems in general. When you have some drops going in there or something like that, it's not going to hurt. And as you said, I recommend too, if you want to throw a condom over it, you can do that as well for your male patients. But in general, I tell them, don't worry about it. It's going to be okay. It's not going to hurt anything. There's not, people drink urine in the deserts and stuff to save their lives. You can drink urine.
That's right, right. I
I'm
mean,
not,
I know. Yeah, I agree with you 100%, but people think that it's such a terrible thing. You know, the other thing too is sometimes different positions might help. What I've sometimes told patients now, well, let's talk about, is there a certain position that you do during sexual intimacy that might be triggering this? Sometimes it's a missionary position, right? With a man on top or whatever, putting pressure on the bladder may cause something. Maybe change position, okay? I try to talk with them about trying to determine maybe what I call a trigger to it. Positioning may be a trigger. Like I said, drinking a lot before having sex may be a trigger. I don't know. Or having caffeine. Caffeine we know is a trigger. Alcohol we know is a natural diuretic. So that causes irritability. So think about all those things. But sometimes a changing position might really help. Okay, that, my female patients, I'll say, well, maybe on top, you being on top might be better as far as, because you're totally away from that bladder, really. No pressure on it at all. That might help. So that is also sometimes beneficial to think about positioning.
So, we've been answering this question, but this question came in and I think it's perfect for what we're exactly talking about. For someone like me dealing with urinary leakage during intimacy or orgasm, what strategies beyond Kegels can help me feel more confident and in control? And I think you highlighted beautifully. Be sure you're not having any bladder irritants, which can be coffee or alcohol or even spicy food. Sometimes may or may not be for you in particular a bladder irritant. Empty your bladder right before sex. Those you've given some excellent points that I do with my patients as well. Any other thoughts or ideas for this listener?
No, I think that, make sure you void, make sure you urinate before sex. Okay. Make sure that bladder's empty. I think that's really important because if the bladder is empty, it never empties to zero, but you should have just a little bit left in there, a couple, maybe an ounce or so. Then your is not going to come out during sex. So that's another thing, is make sure you urinate. And like you say, Jeff, irritants that might be irritating, maybe cut down on fluids if you think you're having sex tonight or in the morning. If you're having sex in the morning, make sure you go to the bathroom before that, because that's going to be a large amount in your bladder. It may interfere with some of that intimacy or the mood or whatever, but that might be important. Again, if you're thinking about morning sex, hey, go to the bathroom before you have it.
Yeah, I think those are some great tips. And then too, listener, most of all, just enjoy. It's supposed to be fun. It's supposed to be pleasurable, and there's no reason to get uptight. I know many people with these problems are very hypersensitive about the urine leak, about so many things to do with it, but it's not going to hurt anything. And so try your best to just relax and really enjoy the moment and be present in the moment. That can be really important too. And realize, this is so important, that you are not defined by urine leakage or incontinence. That's not who you are.
Right.
You are this beautiful sexual being, and you have incontinence or urine leakage problems. We've given you some strategies to deal with it, but it's not who you are. You're so much more than that. And hopefully that will build your confidence back.
And you're really, Jeff, you're not alone. There are people that have this problem. There's no question. I had to tell you a story that it happened to me. It was a woman who was in her 30s. She'd had her second baby. Her daughter was, I think, 4 years old, and she wanted to get pregnant again. But she came to see me because she had some stress incontinence after the last child. And she said to me, and we're talking about it, and I asked her if she had, any leakage during sex. I asked that. It's part of my history. What about, first, are you sexually active? And then she said, well, not really, she said. And I said, well, why? She said, well, because, I'm really worried. I know I leak. And then we're talking about things. And then all of a sudden she tells me that she wanted to have another child. And I'm sitting there looking at her and I said, no, wait a minute. You're telling me you want to get pregnant again, but you're not having sex because you're worried about leakage. And, I think there's a lot more women in that age group who've had children, who have stress incontinence after childbirth, who really avoid sex, Jeff, because
Yeah.
of the issue, because they're so embarrassed and they don't talk about it. And I think that, I just, sometimes it astounds me, but it doesn't, because I think, it's such an incontinence, urine leakage is such an embarrassing thing to then put it in with, I have this problem with sex and any kind of intimacy. I think it's just doubly
Yes.
embarrassing.
Totally. But you're not alone. First off,
Right.
as we get older, pretty much all of us have had some sort of leakage episode. It's gonna happen. It's part of life. I always say, I'm a big hiker, and I always say, what do you do like on these trails, and there's other people on the trails and there's nowhere to go to the bathroom? Do you wear like a pull-up or something? It's like, and then you get to a place of urgency, and now in my 60s with men with our prostates and stuff, it's life. It's part of it. It can happen. So please, men or women out there, know you are not alone. Millions of people suffer with these issues, but there's no reason to suffer alone, because trust me, urine leakage, most of us have all been there or done it. It's happened, even I have my men who say, gosh, I keep a jug in the car. I try to do,
Yes.
they have all kinds of different things. I have patients who are like, I could tell you where every bathroom around Chicagoland is because I know where they are. I have to. So I really think it's so important for people to know that they're not alone, and that there's things that can help, like the pelvic floor exercises. So
Right.
my other question that came in for you is for listeners who feel discouraged because they've tried Kegels before, pelvic floor exercises, and didn't see results. What might have been missing, and what would you suggest they do differently at this time?
Well, I have to go back to, I did say that most of people that come to see me say they've been doing these exercises, and I find they're not doing them correctly. So that's why I stress to you as far as correct muscle. Remember, the muscle is like a hammock in the pelvis. It slings around the rectum. So like, that's why we talked about contracting and tightening your anus, which I think a lot of us, almost all of us know how to do. The other thing you want to do too is make sure you don't tighten your abdomen, so you're not holding your breath whenever you're trying to contract the muscle. You're not lifting yourself like this, because that means you're tightening your gluteal muscle, or your butt. Okay, you don't want to do that. But I really suggest you doing it again. Now, let's talk about something else. That there are devices out there that are available. There's actually quite a bit of devices for women that can go in the vagina, like a sensor that actually Dr. Kegel actually did one. They say he did in his garage. It's like a device, almost like a tampon, that can go in the vagina, and it's hooked to a little, like, it looks like a little phone, and it tells you, it gives you, like, to contract, you can see numbers go up. So it increases numbers. So there are devices out there. If you go on Google, you can find some devices, home devices you can use to learn to do pelvic floor muscle exercises. For men, there's not as many, because of the fact that men, of course, but there are devices you can put in the rectum that as you contract the pelvic floor, again, one of the devices, lights go up. You go from red to green lights. Others have numbers go up. So as you contract the muscle, you go from like 0 to 10, that type of thing. So there are devices out there that if you really want, and I always say that if I had this problem, I really would probably get a device and use it throughout my life, because it's a healthy thing to do. We do a lot of things, Jeff, with tightening and strengthening our muscles in the gym, right? So think of the pelvic floor muscle just like another training of a different muscle. You may do, lifts, you lift weights and that. Well, this is a way to tighten, to really work a muscle that's more internal, but the concept is you've got to rehab it. And that's really what we're saying.
Definitely. So a couple things, like you said, ask your provider, if you're a woman, ask your OB-GYN, your gynecologist, or even your primary care. Any of them can evaluate this and teach you usually, but for sure, Your urology clinicians can do that. We teach people all the time in urology how to do these. A lot of times your OB-GYN is comfortable teaching you as well. And if none of them are, they can give you a prescription for pelvic floor physical therapy to see.
Oh, that's true.
To see someone who can teach you to and make sure they can do biofeedback. They can make sure you're doing it exactly right. There's no doubt about it. And two, like you said, there's not as much for men. But remember, men, you can look in the mirror. You can see that penis and that scrotum bob up when you do it correctly. It just moves slightly when you're doing it right. So that's an advantage. And that may be why, you don't have so many devices. And remember, the devices are designed to go in the vagina. On men, they go in the rectum, and they can be really helpful too. But you can just ask your provider to help evaluate that for you. It's really easy to do, or that if not, you can get a prescription for pelvic floor physical therapy. So much good information packed into this, really. So I hope people understand first and foremost that they're not alone, and then that these exercises may be a helpful thing for them to learn and do. And they can do them properly, and it can be life-changing. I'm going to go, as we do, to our closing centering exercise, and then when I come back, I'd like to just see if you have any final messages for our listeners, and we'll close out the episode. But as we do, I'm going to go to my closing centering exercise now. As we close today's episode, as we always do, I invite you to take a moment to reconnect with your amazing body in a gentle and in an intentional way. If you're able, sit comfortably or lie down, get in a comfortable position. Allow your shoulders to soften and take a slow, deep breath through your nose and out through your mouth. Continue that breathing pattern in your nose and out your mouth. Now bring your awareness as you breathe to your pelvic floor. The muscles at the base of your body. There's nothing you need to force here. Just a quiet noticing of those muscles. As you inhale, imagine the pelvic floor gently expanding and softening. As you exhale, gently engage those muscles as if you're subtly lifting or supporting from within. No strain. Don't hold your breath. Just a light, controlled contraction as you're doing your breathing. If you're sitting, as we said earlier, you'll feel that contraction occur. You'll feel the pelvic floor pull up and away from that chair a little bit. Continue this for a few more breaths. You can gently contract. You can do a quick or a slow one, whatever feels comfortable to you, or you can try both. Inhale. Exhale. Breathe through it. You should not hold your breath as you're doing your pelvic floor contractions and releases. Notice the rhythm. Notice the connection between your breath and your body and your pelvic floor. This isn't just exercise. This is awareness. It's presence. It's a way of rebuilding trust and communicating with your body. When you're ready, let the muscles fully relax. Don't need to do any more contractions. Return gently to your normal, natural breathing pattern. Soften your eyes or open your eyes if you've had them closed. Carry this sense of awareness with you as you move forward through the rest of your day. Because intimacy, whether with yourself or with a partner, begins with connection. So important. So, Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
When sex becomes about doing it right, intimacy can suffer. In this episode, Dr. Jeff and Nicholas A. Mayo Aether explore sensate focus, a mindful approach used by therapists, counselors, coaches, and couples to reduce sexual anxiety, move beyond outcome-based sex, and rebuild connection, safety, and pleasure. Ideal for those facing dysfunction, recovery, or disconnection. This conversation offers a compassionate, evidence-based path back to intimacy. Join us on April 7th at 7 p.m. Central Time to learn more.
Awesome. I'm excited about that episode because people are always asking, what is sensate focus? And we're going to talk about it in detail, and it's going to be a really great conversation. But today, gosh, Diane, I remember when I started in urology, how much I learned from you, and over the years, how much I've learned from you. You've written amazing books. You have done lectures. You've taught patients and clinicians around the world. I just can't think of someone better to have talked about this subject. Thank you for taking time to share your expertise on pelvic floor exercises and their role in sexual health, incontinence, and all these important areas. I just really, truly appreciate it.
Well, thanks for having me. I just want to say thanks for having me. And my parting message for anybody listening is, don't just live with this. Don't just live with this, please. Seek treatment. You're not alone.
And that is a beautiful party message. That's what I started to say. And what is your party message? So Diane is an avid educator and podcaster. So this is like a whole synchronous thing we got going here because we've done quite a few things together over the years. Listeners, just as Dr. Newman said, and it's so true, you are not alone. Millions of people struggle with these issues, and you are not defined by these issues. There is help and there is hope. You are not your incontinence. You are so much more than that, and you are deserving of love and belonging. So step into the pleasure zone. Don't be afraid to do it. Don't let incontinence define what you do with your life and your pleasure. Thank you for joining us, and goodbye.
Who's Dr. J?